Thank you. Senator Murphy.
Thank you to this tremendous panel. Thank you, Madam Chair, for convening this hearing. Thank you, Senator Cassidy, for your heroic work standing up for people with mental illness and learning disabilities. And if I can just for a moment lift up a piece of legislation that Senator Cassidy and I worked on and this committee supported. We passed legislation through this committee making real the mental health parity legislation that Congress passed decades ago. The reality was we told plans to cover mental health just like you cover health for the rest of the body, but it didn't work out that way. Plans ended up putting up all sorts of barriers and bureaucracy and red tape in front of getting reimbursement for mental health that they didn't for an orthopedic procedure or an operation on your heart or lungs. One of the things we did a few years ago is require the Department of Labor and Department of Health and Human Services to do an audit of a select group of insurance plans. And we just got the report. It's both defeating and encouraging. It basically came to the conclusion that not a single insurance plan that they reviewed was in full compliance with parity. But through these audits, they actually got the plans to change their practices and parameters such that now tens of thousands of mental health consumers are now actually getting what they paid for when they paid their insurance premiums. An example is, one insurance plan was covering nutritional therapy for diabetes, but was not covering it for anorexia, bulimia, or binge eating. Another example was a plan was requiring prior authorization for all outpatient procedures for mental health and substance abuse, but was not requiring it for a broad range of orthopedic procedures. So we're finally getting this right, and I wanted to maybe pose this question to you, Dr. Durham, to talk a little bit about your experience in dealing with insurance companies and families who are trying to get reimbursement and the differences that you see in a big medical system in the way that barriers are put up when it comes to mental health and substance abuse that just don't exist when you're going to get the follow-up treatment on a operation on your knee. I think we're making progress here thanks to this committee, but I think we still have a long way to go.
Thank you, Senator Murray, for your question. I agree completely that none of this is new to us that are on the front lines, that are serving patients day in and day out. That I have not read the report in fully, but I understand that, and all in all, that insurers are not allowing us to treat people with the best evidence at all times. Whether that's medication, whether that's therapy, whether that's trying to get them into another facility for more intense care. And so what happens in our emergency room, for an example, is that we do have to get what we call a prior auth prior to sending someone to an inpatient psychiatric facility. You would never do that with someone who comes in with a heart attack to the emergency room. They immediately go and get the help they need on the medical floor, and no questions asked. And so we spend hours sometimes, our social work colleagues, ourselves, our case managers in the emergency room, just trying to get someone placed. And at times, they're to the level of where someone like me as a physician has to do a doc-to-doc to essentially say our case. Why do we want this patient to go into an inpatient psychiatric unit? And there are times where we're denied and we have to figure out another level of care. In the outpatient world as well, I'm a child psychiatrist and I see kids in the clinic. And I have been on the phone with an insurer as well when a medication adjustment needs to be made. For hours. So my time in the clinical setting where I should be seeing patients is spent on the phone trying to essentially get a kid that was always on a medicine, but the formulary changed and I wanted them to continue that medicine. We need a lot of help in this area. We need to have parity for physical and mental health and not have to be at the beck and call, if you will, of these prior auths.
Very well said, and this is an issue I know that there'll be bipartisan agreement on because we're just asking for compliance to the existing law. We don't have to pass a new requirement on insurers. We just have to give the tools to the departments to make sure that the insurers comply. I'm going to submit a question for the record to the panel with respect to how we get more professionals who are in contact with kids a little bit of extra learning on mental health first aid and mental health diagnosis. We spend billions of dollars on training for teachers and for pediatricians, and we could do better by giving a little bit additional help on identifying some of the root causes. And lastly, let me just say thank you to you, Ms. Rainier. Thank you for speaking truth to power on this issue and for standing up for kids. I'm a parent to a teenager and a preteen, and so I see the rabbit hole that kids can go down when they are experiencing those first signs of crisis, given how online some pretty toxic information and influences are, and I think you've opened our eyes to that with your testimony today. Thank you, Madam Chair.
Thank you. Senator Braun.